One of the common statements I hear as I work with clinicians about value-based care is that I can't succeed. This is too challenging. This is too hard. And it's important when I hear those statements to make sure that the clinician reframes the value of the services that they generate. And I really do that by recommending that they try 3 different tools or 3 different steps in their day-to-day practice. The first is if they do see themselves as a clock puncher or a piece worker getting paid per patient or getting paid per hour, is that when that hour is up, as an experiment for a couple of days, go home. Leave all of your work unfinished, go home. You're working on the clock, okay? The clock ends. Once the clock ends, you should go home. Any reasonable person would not expect you to work for free. So go home, and then the next day, see how much work piles up from the day before. And that is a rough assessment of how much value that you're generating. Without that, without your presence, that work doesn't get done, and yet you're not getting paid for it. Another useful tool is to spend 1 to 2 days doing a very specific time logging exercise where you log every minute of what you do during that day. And then you sit down and you look, holy cow, out of this 10-hour day, only 4 of it was actually seeing patients, which is the only thing that I get paid for. Everything else is uncompensated. That doesn't mean it doesn't generate any value. It just means that it's uncompensated. And that'll give you an idea of how much value you're generating that's not compensated. And the third thing is for specific patients, follow them through the healthcare system. See how much cost they generate when they go through the system without you being able to mentor them the way that you feel like you should, but you can't because you're not compensated in that way. You do those 3 exercises, and what I find is that the light bulb comes on, and they get much more interested in finding out how they can get paid for the value that they generate.